This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2017. Between 1997 and 2010, the use of prescription painkillers in the United States increased by a factor of 4, and post-operative overdoses by a factor of almost 2. Prescription painkillers make pain management easier, but their continued use can put one at risk of dependence and addiction. A group of researchers looked to study patterns of use of prescription opioids after spinal surgery and determine if factors like surgical intensity influenced prolonged use. Using TRICARE insurance claims data from across a 9-year period obtained from the Military Health System Data Repository, the study examined almost 10,000 previously opioid-naive patients. These patients had undergone one of 4 common spinal surgical procedures that were classified as either high or low intensity. Surgical intensity apart, the study looked at age, mental health disorders, and socioeconomic status as possible risk factors for prolonged opioid use. 84% of patients received at least one opioid prescription at discharge. After 1 month, about 8% continued use. At 3 months, this dropped to 1%, which further slumped to 0.1% at 6 months. At 1 year, only 0.02% of patients continued opioid use. Clearly, spine surgery among opioid-naive patients was not a major driver of long-term prescription opioid use, although it was found that lower surgical intensity meant higher chance of discontinuing opioid use sooner. Depression, age, and lower socioeconomic status were found to decrease likelihood of discontinuing opioids. The large and geographically spread study cohort and the 18 to 64 patient age range mean that the findings are applicable to the population at greatest risk of chronic opioid use. Yet, though relevant, these findings must be treated with caution, as they require further validation. Nonetheless, they raise important issues in the use of prescription opioids, as these medications have been seen to be a first step toward a process of opioid dependence and addiction.